Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Health experts recommend that you exercise at least 30 minutes every day to keep fit, but most importantly to reduce the risk of non-communicable diseases like high blood pressure and heart-related complications. However, different people exercise for different reasons, including building muscle, toning the body, and flexibility, among others. And for such reasons, some of you often push your bodies too far, risking injury. Dr. Ruth Valemezi, an occupational health specialist, says she is seeing more patients with self-inflicted injury.
Exercise is a very, very good thing with numerous benefits. It increases our heart function or cardiovascular function. It increases our cognition, the way we think. It increases our moods. It helps us to build muscle and build the bone density. It helps us in so many ways. However, just like food is good, if it is eaten in too many or too much quantities, it will destroy us. So exercise can pose risks as well. If the heart gets overwhelmed, you can get a cardiac problem. Or the muscles also do get injuries. But we regard the muscle injuries or injuries to the bone, the muscles, as minimal because the cardiac problems are life-threatening. If you get a problem on the heart, you can, boom, die immediately. Yet with the musculoskeletal, you can survive with the injury and you go for rehabilitation. So even sports people, that's why we recommend exercise prescription and testing.
Dr. Valemezi says the common notion that exercise must be really hard or painful to be beneficial is simply wrong. Moderation is the key to safe exercise.
Especially the intensity and the type of exercise that you do. There are people who will walk away, who will wake up and run just like that and it's okay. And there are people who will not be okay. And it will cause risks, especially to the muscle or the musculoskeletal system, what we call the muscles, the nerves, the ligaments, the tendons, and worse still, the heart or the cardiovascular system. People can get cardiac arrests or heart failures.
Exercise prescription commonly refers to the specific plan of fitness-related activities that are designed for a specified purpose, which is often developed by a fitness or rehabilitation specialist for the client or patient. Dr. Valemezi explains what an exercise prescription entails.
We evaluate your muscles, we evaluate your lungs, because also lungs are part of it. Then we also look at your metabolic function. How are the other organs going to respond, like the kidneys, the liver? So after that, we create a dose for you that will not hurt their heart, that will not affect their heart, that will not affect their lungs, that will not affect their organs, that will not affect their muscles so much.
The simplest way out for you to determine how far you can go while performing some exercises is by ensuring you are not one with some risk factors.
If someone has made 55 and above or 50 with a history of a sedentary lifestyle, that person is more at risk when they don't always exercise. Then we have people with sickle cell anemia, hypertensive people. It should be regulated, especially when it's not controlled. That exercise should be regulated and prescribed on how they should exercise. Pregnant people, people with diabetes, or people with a history of family or anything related to histories of cardiac problems or problems of the heart.
But also take precaution. Don't try to be someone else. Exercise according to what your body can take at a time.
If you start breathing in unusual ways, if you get a blurry vision, if you feel like, they normally push you like in groups, keep running, keep jogging, but if you feel that you cannot do it, do not take it. The body can speak. It shows you that, man, we are moving, but this is so much. And gradually, you can go to that level. For example, you can start with low-intensive exercises like walking before you go to jogging. Don't wake up and just take on the marathon there and then. That's why there was this training, stretching to prepare the body to manage the stress that you're going to give it through exercise.
Accidents can happen despite safe exercise precautions. If you pull a muscle or worse during exercise, apply a protective device such as a sling, splint, or brace. See your doctor if you have severe pain, cannot move the injured body part, or if symptoms persist. Walter Mwesigye, NTV.
National Medical Stores, NMS, passionate about your life with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.